Well, it's the Drive Time Talk, and I think we are through the vernal equinox. I think it's vernal, whatever. But basically, the days are getting longer, and the days are longer than the nights now. So it's nice to get out of work, even a little late, and we still have sunlight. So, real quickly, let's talk about blood work. The way that functional medicine doctors look at blood work is different than the way medical doctors look at blood work. Medical doctors do a great job at identifying acute illnesses. We're going to go through the sneezes again. So you have things that happen and, overt infections and things like that. And they're great at identifying those, and they're great at identifying pathologies. But a lot of people, to borrow a term from Dr. Hyman, a lot of people have normal blood work, but they feel like crap. Why? And you have to understand how they get their numbers. I don't know the specifics on how many times or when they actually refigure, but I do know that basically hospitals and labs take the cohort of people, and this is an oversimplification, but they take the cohort of people, which means all their people, and they start to say, hey, let's look at the labs, and here's a line, and we're going to put dots where everybody is at, and where 80% of the dots are at, then that is your normal. And then they give you a standard or two deviation above and below that. The problem is our health has continually gotten worse. And so now what's normal is normal for sick people. And so what the functional medicine doctors have done is they've rolled the clock back on that. And they've gone back to a very large cohort of blood, which is that of the World War II veterans. And they started to use those numbers. And now we can start to see things early as they are trending in the wrong way. And before I run out of time, here's a little sample of what I mean. Go to look at Woodstock 1969 and find people that look like me or look like your typical American in that photo. And you won't see it. And that's because their food system and their health, their activity, their sleep, all of that is much better than ours in every aspect. And so we've got to get back to a time when it was simpler. If you have any questions, reach out.